So you may have been diagnosed with IBS and you could be wondering, what the heck is IBS? What are symptoms from it? What causes it? And what can I do to help out with my IBS? Well, in this video today, I'm going to answer those questions. Exactly what is IBS? What causes it? What are those symptoms? If you wait to the very end of the video, I'm going to give you 7 foods I recommend as a GI doctor to eliminate to get your IBS under control. And as a bonus, yes, I'm going to give you a bonus tip. More towards the end, I'm going to tell you 5 foods to add to your diet to help out with IBS. Guys, let's talk about poop. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your gut health. If you haven't already, don't forget to smash that like button, like, share, subscribe. And also, if you haven't already signed up for my weekly newsletter, I'll put a link down below where you can get great tips on what to do with your health. So, what exactly is IBS? I know it can be very frustrating when you go to a doctor and say, hey, you have IBS, good luck, you're off on your own. Well, let me tell you exactly what IBS is. So IBS stands for Irritable Bowel Syndrome. This is a real disease. It's not in your head. You're not going crazy. I promise you, you're not. And there are so many people that have Irritable Bowel Syndrome and they don't realize it. So the medical definition, so I'm gonna wear my cool glasses, my fancy white coat, and be all doctorish now. But it's defined as a chronic functional bowel disorder that can cause a change in your bowel habits with abdominal pain. Now, what that fancy word means is that you've had these symptoms for quite some time, which is why it's chronic. It is a functional bowel disorder, meaning we can't find any structural or lab abnormalities that are there, which can be very frustrating for our patients. And you have to have pain as a symptom whenever you have IBS. So pain has to be a predominant factor when it comes to your bowel issues. Now there's 4 main types of IBS. And the way we classify IBS is that we classify it based on the most predominant symptom that you have. So we have IBS-D, D for diarrhea, IBS-C, C for constipation, IBS-M for a mixed pattern, both diarrhea and constipation, and IBS-U, which is an unclassified diagnosis of IBS. But irregardless of what your symptoms are, the most predominant symptom typically is pain that tends to get better when you have a bowel movement. Now, when you look at the whole spectrum of patients who have IBS, the most predominant symptom, the vast majority of people have diarrhea as a component, whether it's IBS-D or IBS-M. So most likely, if you're watching, you have diarrhea as your main symptom. However, I can tell you there's so many other symptoms that are associated with IBS that you may not realize. There are other symptoms besides pain, diarrhea, constipation. Could be bloating, upset stomach or indigestion, nausea and or vomiting, a change in your bowel habits, belching or flatulence. Yeah, flatulence, great word. But you can have non-GI symptoms associated with IBS. It can be painful to have intercourse. You can have problems with urination or just having the urge to have to urinate. You can have fibromyalgia. Your sex drive may be low. You may just feel tired and fatigued. This is all part of the IBS spectrum. And so it's hard for us to know exactly which one of these symptoms are specific to IBS because a lot of my patients that have IBS complain of all of these. And the difficult thing is that you may have these symptoms on one day and it could change the very next day. And that is the difficult thing about IBS is that these symptoms are so sporadic, they're very random. It's hard to know exactly what the trigger could be. So what exactly causes IBS? Unfortunately, we just don't know. We know it's a multitude of different things, whether it's diet, changes in your gut microbiome, leaky gut, chronic inflammation, stress, or the connection between the brain and the gut. There could be a genetic component. And so because there's so many different factors playing a role, we don't know exactly which factor is going to play a role in your particular disease process when it comes to IBS, which can be very frustrating for both us as physicians and you as patients, because I know you want an answer for why you're having your IBS symptoms. And for some people, it could be one thing. It could be a change in your gut microbiome. But for others, it may be a whole constellation of other factors that we have to address to hopefully get your gut symptoms taken care of. Now that we talked about what are the symptoms and what causes it, these are the 7 foods that I recommend as your GI doctor to eliminate when it comes to IBS. Now, before I begin, I want to give a big warning. So we're going to have some sort of graphics out here. An important thing I want you guys to know. Number 1 is that IBS is not just a food disease. So just because you eliminate foods doesn't mean your IBS is going to get better. Like I mentioned before, it's due to a lot of different things. And so for some people, diet works great and they feel so much better. But for others, it doesn't make a difference. And so I don't want you to get stuck that, oh my gosh, I have to keep on eliminating to the point where you don't eat anything. Food may not play a role in your particular IBS. So please, if you try dietary changes and it doesn't work, speak to your healthcare provider. Number 1 is dairy. Yes, you may be lactose intolerant. I am. It sucks when I have dairy. It stinks, I get bloated, I have gas, and my wife is not happy. Oh, wait. So, you may want to consider eliminating dairy if you have IBS, because this could be a reason why you have some of the gut issues that you're having. You may not realize that you're lactose intolerant. So that includes things like dairy, milk, cheese, ice cream, my favorite, but yes, you may have to eliminate that. So number 2 is processed foods. Processed foods are not good for your gut, guys. I'm sorry. I can't tell you it's going to make you feel better. It's not. So try to eliminate that to see if you feel any better. Number 3 are very greasy foods. So maybe a nice burger, a lot of fries, maybe some cheese. Oh, no, guys, that is not good for your gut and it can make your IBS symptoms worse. So try to minimize, or if you can, eliminate those types of foods. Number 4, coffee. I know, I'm a coffee lover, but coffee actually acts to stimulate your gut. It moves things faster, gets things going, contracts more, and so you may be one of those that could be having coffee as a particular trigger for your IBS symptoms. So try to consider eliminating that. Next is alcohol. Yes, alcohol has a lot of products in it that are not good for your gut. Things like certain carbohydrates, the fizzing, the direct toxins inside your body. You may be one of those that you may have to eliminate or minimize alcohol. FODMAPs. So FODMAPs are a group of carbohydrates that tend to produce a lot of gas. I'll put a link in the YouTube card about my video on FODMAP. So for a lot of our patients who have IBS, we put them on a low FODMAP diet, which the evidence seems to suggest this can really help out with some of your gut issues that you're having. I would recommend for you to not do this until you speak to your healthcare provider, because there are certain things we have to check and make sure that you're doing the diet correctly. Then lastly, gluten. What? Yes, so there is a condition called non-celiac gluten sensitivity. This is a real condition. It's not just a fad. And so some people actually have an intolerance to gluten. They may have a lot of gut issues, bloating, brain fog, and it's a real condition. And so for some of my IBS patients, I recommend for them to go on a gluten-free diet and seeing how you feel. Now these are the 7 foods I recommend for all my GI patients to eliminate to help out with your IBS. But guys, I just don't want to eliminate things. I want to add things in. Yes, because I'm your poop guru. So here are the 5 foods I recommend for you to add on to your diet to see if we can get your gut feeling better to help out with your IBS. Number 1 is fish. Yes, I'm a big proponent of a fish diet, or more of a vegetarian type diet. Fish is good for you. It has good fat, has good antioxidants. It can really help out with some of your gut issues. So try to incorporate fish in your diet. Number 2 are cooked vegetables. Cooked vegetables are a lot easier to digest than raw vegetables. But not only that, they have a lot of minerals and vitamins to help out with your gut issues you could be having and to help out with your IBS. Keep in mind though, there are some vegetables that are in the high FODMAP group. So just look at those vegetables and make sure you're not actually making things worse. And so those vegetables that are high in the FODMAP include things like broccoli, cauliflower, cabbage, and Brussels sprouts. So let me tell you a story, okay? I got obsessed with eating Brussels sprouts, I don't know, for about 2 or 3 months ago. And then I started noticing, I didn't. My wife did, that, you're pretty gassy. I'm like, what? Me? I have a gut of steel. It's good. No, it was not good. My wife was not happy. We realized it's those Brussels sprouts. So for me, Brussels sprouts, I can't do it anymore. It's causing me gut issues. So those particular vegetables are in the high FODMAP category. So you may want to consider not introducing those particular vegetables, but other cooked vegetables should be good for you. Number 3 are whole grains. Now, whole grains have a lot of fiber in them. And if you've watched multiple videos of mine, I truly believe that fiber is the foundation for your gut health to help build yourself up and get you feeling better. And so whole grains, especially grains that are not processed or maybe don't have gluten in them if you're gluten intolerant, can really help out with some of the gut issues that you're having and introduce fiber into your diet. Number 4 is low-fat yogurt. Now keep in mind, if you are lactose intolerant, don't do this, okay? Because this has dairy. But for those of us who don't have lactose intolerant, low-fat yogurt has a lot of probiotics in them. It has a lot of gut bacteria in them. And for a lot of my IBS patients, there is good evidence that a low-fat yogurt can really help change the gut microbiome. And number 5, consider turmeric. Turmeric is a very effective anti-inflammatory herb. We use this for a lot of patients who have maybe arthritis problems and can help out with gut issues as well. My recommendation is to use turmeric powder as opposed to turmeric pills because you're getting more of the essence of the powder for your gut issues. However, if you can't tolerate the powder, try using a turmeric pill instead. But guys, I hope this video was helpful. If you have IBS, don't feel like that it's all in your head or that you're suffering by yourself. A lot of people have issues with this, and my job is to make you feel better. Guys, my question today for you, what have you done for your IBS? What foods have worked? What foods didn't work? Let me know down below. I'd love to hear what you guys have to say. But I want to thank you for watching. Don't forget to smash that like button. Like, share, subscribe, do all that jazz so all the social media channels know what I'm talking about. I want to thank you for watching. Hope you guys have a great day. Take care! To your diet to help out with IBS. Guys, don't say it didn't help. No, wait, scratch that. Or you can have all of them one day and not any of them the following day. It's hard to really classify. Scratch that. Number 2 is processed food. So those are foods that you just get anywhere. Sorry. Fish is good for you. It has good fat, has good antioxidants. It can really help out with some of your gut issues. Excuse me, golly. Speaking of gut issues, sorry about that. Don't do this because this has